All right, good afternoon, everyone. The August 22nd, 2023 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mr. Blankley. Mr. Blankley is present. Mr. Brew. Mr. Brew is present. Ms. Delvecchio Hoffman. Ms. Delvecchio Hoffman is present. Mr. Dondorfer. Mr. Dondorfer is present. Ms. Hasman. Ms. Hasman is present. Chairman Keller.
Here.
Chairman Keller is present. Mr. Morris. Mr. Morris is present. Ms. Smith. Ms. Smith is present. And Mr. Udelson. Mr. Udelson is present.
Is there anyone signed up for the public forum?
We do. We have 2 people registered to speak. I'll call you up one at a time, and each person will have 2 minutes in which to address the committee. And then please conclude when the timer sounds and then exit through the chamber doors back here. Our first speaker is Michelle McGrain.
Hi, my name is Michelle McGrain. I work for the Department of Social Services. I'm actually speaking on behalf of a coworker who got called into her second job this evening and couldn't be here. This is from Christine Hardy. I am sure I'm not alone when I tell you how frustrated I was to read the news about the reallocation of $1.8 million from DHS fund to the zoo and golf courses. As a DHS employee of 9 years, I've experienced the challenges of being short-staffed. I have volunteered many hours of my time to ensure a family receives their food stamps or can move into permanent housing. In my current role as a senior Medicaid examiner, what we do is far more behind the scenes and not as newsworthy, but nonetheless still impacts a vulnerable population of our community. We don't make the news like CPS, but that is because no one realizes the importance of something until there is a tragedy. We work every day to prevent this from happening. We provide health insurance coverage for over 65 population, or at least we are trying. As New York State comes out of the PHE, which is the pandemic, we are inundated with recertifications. Many of our workers have 200 to 300 recertifications a month on top of all their other duties. We are unable to meet the deadlines to complete these, so we extend the coverage as is. In the majority, if these cases our elderly would become fully eligible for Medicaid and not have to struggle each month to decide between paying for their medications or purchasing food or paying rent, mortgage, or paying RG&E. We cannot rebudget all of these cases because we simply do not have the staff or the time. We have increased staffing and we appreciate that, but who trains the staff? The average time span to have a Medicaid worker who can process these cases is 1 year. We have to pull staff to train and review work. We are backdating coverage many months later. However, many of these senior citizens have already paid hundreds, if not thousands of dollars in co-pays and had to stretch their Social Security income when they shouldn't have had these expenses. We fight for the 5 hours overtime a week. Every week we hear that the county does not have the money in the budget for overtime and it will be ending any day. Thank you.
Our next speaker is Christina Chrisman.
Hi, everybody. My name is Christina Chrisman. I'm the president of the Federation of Social Workers. Our members work throughout the Department of Human Services. A lot of them were very surprised to see that on the news that there was money being transferred to other departments, namely because over the last 6 months, we've been continuously threatened that overtime would be ending soon. Mainly because there was no money in the budget for it. Like the previous statement addressed, we have gotten a lot of new people in. Thank you for all of those efforts, but it does take time to train people. We don't have enough people right now to process all of the work that's coming in. Just as many people that are coming in, we're still losing people every day. We have 2 large classes, starting one in September, one in October, of roughly 30 people each class. But it's going to take even more time to train them because we're already struggling to keep up with the research and stuff that's coming in. For a long time during COVID, Medicaid was on pause, meaning that there were no negative actions on Medicaid. People didn't have to do recertifications. That all ended in July. Recertifications started coming back in. We don't have trained staff to keep up. Right now, they're getting 5 hours a week of overtime. Previously, we were getting 10 hours a week of overtime. We were asking month after month after month during our labor management for the overtime to continue at 10 hours a week. Not everybody works it, but for the people who can, it helps a lot. And especially now with the increased workload and people not being fully trained, it's really needed. It's not uncommon to hear about people waiting 2 to 3 hours on the phone just to get a hold of SNAP customer service. We're still struggling with that, but you get the gist.
Is there anyone present who is not signed up to speak who would like to address the committee at this time? All right, the next item on the agenda is approval of minutes. You have the July 25th, 2023 minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. The next item on the agenda is new business. Mr. Clerk.
Referral 23-0257, amend resolution 215 of 2019 as amended by resolution 315 of 2022 to accept additional funding from the New York State Department of Health for the Tuberculosis Prevention and Control Program.
Moved by legislator Smith, seconded by legislator Dondorfer. Are there any questions? Legislator Smith.
TB cases are there in Monroe County each year?
Through the chair, it of course varies by year, and I can give you the last several years of actual cases of tuberculosis disease. In 2022, there were 11, in 21, 14, in 28, in 19, there were 15, and in 18, there were 16.
Thank you. And another question through the chair, will any of these funds be used to support this type of activity with any of the recent migrants that have arrived in our community?
Through the chair, this particular supplement was given to us specifically to address the needs of the Ukrainian humanitarian parolees, but with language attached that said we could use it to assist with similar like populations. And so, because the activities that the team does are going to be similar to what we would do for the Ukrainians for the new asylum seekers, then we really don't differentiate when we're doing the activities that today's activity is paid for by this money and tomorrow's activity is paid for by some other money.
Okay, thank you. I have one other question. I just want to read. I'm done. Thank you.
Or any further discussion? All right, all those in favor, please signify by saying aye. Aye. Are there any opposed? Next item, please.
Referral 23-0258, amend resolution 266 of 2019 as amended by resolution 354 of 2022 to accept additional funding from Columbia University and extend the time period for the Healing Communities Study Program.
Moved by legislator Dondorfer, seconded by legislator Morris. Is there any discussion? Legislator Dondorfer.
Chair to the administration, what evidence has been collected to date?
Through the chair, the results of this study are still being put together. They're actually on this Friday, August 25th is going to be one of the first presentations about the lessons that have been learned from this study. So we can get back to you with that information.
Any further discussion? All right, all those in favor, please signify by saying aye.
Aye.
Are there any opposed? Next item, please.
Referral 23-0259, acceptance of a grant from Health Research for the Strengthening Public Health Workforce and Foundational Capabilities Program.
Move it, Mr. Chairman.
Moved by legislator Morris, seconded by legislator Brew. Is there any discussion? Legislator Morris.
Through you to the administration, what has been funding this program up to this point?
Through the chair, this is a new program.
It initiated last year in 2022, and is this? So it initiated last year, but we're approving funding now, or this finally it's coming due where the funding is now been made available?
Through the chair, we learned of this grant in May. It is May of 2023. It's a year-long grant, but it was supposed to start in October of 2022, or November of 2022. And so we're actually coming up on the end of the grant. And so we put this through the referral process as soon as we were able to. Through the chair.
Question through you,
Yes, sir.
Mr. Chairman of the Administration. How many workers does this support? And generally speaking, I guess, what are the job descriptions or duties?
Through the chair, we are in the process of determining the way these funds will be utilized. In your materials, I believe you have a copy of the allowable expenses. As you can see, there is a huge range of activities that could be used. So we will be surveying the health department to get their input on ways that we can leverage these funds to expand the workforce in our department. And we hope to have that process done this fall.
Follow-up question through you, Mr. Chairman of the Administration, and it may be the same answer for this and a follow-up question. But at this point, do you know what workplace upgrades are anticipated?
Through the chair, we will survey the staff first and determine what would be most useful for the workforce.
And then again, through you, Mr. Chairman of the Administration, and again, this may be the same answer. Question, what public health training will be provided to employees? Do you know that at this point, or is that something that's still being worked out?
Through the chair, it is being worked out. We want to figure out what the staff want to be trained on. But we have considered a variety of training, including diversity, equity, and inclusion, communication. Our EPI team has expressed interest in additional epidemiology and statistical training. So it really depends on the demand. But with this amount of money, we should be able to meet that demand depending on what the interest is.
Thank you. No further.
Legislator Houseman.
Through the chair, we are currently well-staffed in all areas of the department in terms of positions. Now, we don't have all of our positions funded because there's a shortage of nurses and EI provider and so forth. But if we were to expand, I would envision new units that could address different problems in the community. I'm very interested in violence and violence prevention. So that is an area that I'm contemplating as far as expanding the health department.
Any further discussion? All right, seeing none, all those in favor, please signify by saying aye. Aye. Are there any opposed? Item carries. Next item, please.
Referral 23-0260, authorize a contract with Televera to provide nursing services for the Monroe County Department of Public Health Early Intervention Program.
By legislator Brew, seconded by legislator Smith. Is there any discussion? Legislator Brew?
Yes, to the chair of the administration, were there any other respondents to the RFQ other than Talavera? And if
Through the chair, there were 4 other respondents.
Legislator Brew, can you just use the mic? Make sure you use the mic.
to the chair, to the administration, who oversees the program?
Through the chair, I'm the administrator of the program, Early Childhood Development Program, that includes early intervention and preschool special education.
To the chair, to the administration, that department would be considered to be called What within the health department?
Through the chair, that's our early childhood development program.
And through the chair of the administration, could you provide an example of what educating healthcare providers on program components mean? The chair.
Chair,
could
can you repeat the question, please?
Yes. Could you provide an example of educating healthcare providers on program components means?
Or through the chair, our contracted nurse, one of her responsibilities is to follow up on referrals that we receive for early intervention services that maybe don't quite have all of the components, all of the information that we need to proceed with the referral, to contact the family and follow up. So she reaches out to the pediatrician's offices, for example, and talks about the eligibility criteria, what kind of information to send to us when they send us a referral, important demographics that are needed, things of that nature.
Legislator Morris.
Chairman, through you to the administration. So you had mentioned that there were other respondents. Is the selection similar to, say, like a construction bid where it's the low dollar amount that wins, or the, I guess what goes into that decision on why Talavera was selected over others?
Sure. Through the chair, there were a few criteria items besides cost that were taken into consideration, including their experience in similar roles. So for example, working with other health departments as opposed to like hospital or clinical settings. And then their capacity to perform the service. So what techniques do they use to attract nurses for the position?
Through you to the administration. I don't know if I heard it. There were 4 other respondents. Who were the other 4?
Through the chair, the 4 companies were ATC Healthcare Services, the Casswood Group, and CompuVision Consulting. Sorry, one more. GlobeLink Healthcare Staffing Network.
Thank you very much. No further questions.
Further discussion? All right, seeing none, all those in favor, please signify by saying aye. Are there any opposed? All right, item carries. Are there any other matters to come before this committee? There being no other matters, the August 22nd, 2023 meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee will be held on Tuesday, September 22nd.